Megan, I think one of the big things are barriers.
Okay.
We've had several patients that have issues with housing. Some of them have been placed. Some of them have some donations, but a lot don't.
What kind of donations are we having trouble getting?
My name is Megan Williams. Before nursing, I was in finance. I became a nurse because I like to help people. I like to figure out what is important to people and be able to help them solve problems. Within our health system, we have our hospital system that treats a lot of uninsured patients. Some of these patients have no primary care physician, so they'll come to the ER to get their basic blood pressure meds. Some of our patients are homeless. Regional 1 had formulated that there was a problem with the high utilizers of the uninsured population. When we first started this project, our top 25 patients used the emergency room in 1 year on an average of 200 to 30 times. So a small population of people carry the majority of costs for the overall cost of care. The complex care program is around 4 years old. With the intervention of the complex care team, the nurses work with a social worker and start to look at and develop community plans of care and things within the community that we can help them with, which will eventually get to the root of the why they're coming and help to decrease those utilization, get them into appropriate care.
Hey, this is Ashley at Regional 1. How are you? I was just calling to let you know I set your ride up for today. When you come in, I got a pair of shoes for you in the clothes closet. I'm just looking now, looks like your car is on the way. I'll see you once you get in.
In the city of Memphis, the poverty rate is 22%, and the national average in the United States is 12%. The poverty rate is so much higher here in Memphis, and many of the people struggle to pay their rent, struggle to find food, and/or basic needs of their life.
Growing up here in Memphis, it was really pretty rough. You know, as a kid, my dad held down 2 jobs. He inspired me a lot. You know, he made a man out of me early. When I was age of 5, we had to take on a paper route, help out with, the bills but as I grew up and got out on my own, I started doing sprinkler work. And I did it for 28 years until my legs started bothering me. I couldn't walk. I have to work. I have a family.
With Mr. Robert, his story was very similar to a lot of people where he worked the trade job and he worked for a long time, and unfortunately his health declined, so it kind of led him into a situation where he could no longer work, but the bills were still coming in, had no insurance coverage, he had no transportation to his appointments. I had a lot of empathy for him because his story was similar to a lot of people that I know.
2020, my whole body just went paralyzed and I fell out on my face. I had to lay off work for a few months, and the doctor came and told me, said, "You're not going home. You need emergency surgery now." Going through those surgeries, I lost everything. I had too much pride to ask for help.
One of our social workers works as a housing specialist. So once a week, she partners with an agency on the city level to look at patients that need housing, that are homeless. We also have MIFA, which is our Meals on Wheels program. They deliver fresh, frozen, or hot meals to our patient.
When I met Ashley, I was in the rehab, part of the hospital.
How does it feel to be back in this room? Does it bring back any feelings when I met you?
Oh, it brings back a lot of memories because I was about to give up, and you walked in the room. That really changed my life because I was like, I want to know what to do if I hadn't met you.
We were able to provide him and partner with a transportation provider, help him get his medications through our pharmacy program.
They provided me with clothes, shoes, and especially a warm coat. I really needed one. I was so excited when they called me to tell me that my disability was started and my insurance was started.
being uninsured or underinsured, especially when you're sitting in a hospital bed and you don't know what's next. It's not about me and it's not about my team. It's really what we can provide for our patients.
You guys change people's lives. This program is amazing. A lot of people around here in Memphis are going through the things that I went through. Regional 1, this team, I look at, they went out of their way to help me. I wouldn't change it for nothing in the world.
Oftentimes we are the patient's main support role, and we're always here for them. We treat them, we meet them where they're at, and we build on those relationships.
I think the biggest thing about my job is that I don't see my patients as patients. That is my neighbor. That's my grandparents' friends. I grew up in this area. I take pride in that, I do. To do what we do and to make an impact, it's truly amazing, you know. It really is.